Now we're going to look at the scalene stretch. Now, the scalenes are divided into three components. Right here you have the anterior scalenes. Over here you have the middle scalenes, and then not shown here are the posterior scalenes. Now, important note here, the anterior and middle scalenes, they're going to originate off of some of these upper cervical vertebrae, but then they're going to come down here and insert on the first rib. The posterior scalene, in contrast, inserts on the second rib. So there are some conditions like thoracic outlet syndrome where they're associated sometimes with a hypomobile first rib. So because we're thinking about the first rib, we're not considering the posterior scalenes. Okay? We'd only be considering the anterior and the middle scalenes. And in general, we can really get both of these muscles with one stretch, and that's what we're going to look at right now. I can do this stretch either in seated or standing, although seated is probably the way to go on this. And I'm going to begin by bending my neck away from the side that I'm trying to stretch. I'm trying to stretch the left scalene. So that means I'm going to begin with right side bending, and then I'm going to rotate to the left and then slightly look up at the ceiling. That's that neck extension. So there's right side bending, little bit of left rotation right there. And then I'm going to tilt up a little bit. That's that little bit of cervical extension. And I'm going to hold that for about 30 to 60 seconds. I can even palpate the scalenes to make sure I'm getting a stretch of those. They should feel like little stringy muscles that you'll feel just above the clavicle or the collarbone. Okay? So that would be a left scalene stretch. So right side bending, left rotation, and then a little bit of cervical extension should get that. The right scalene stretch is going to be exactly the opposite, although it still follows this rule: contralateral side bending, ipsilateral rotation, and a little bit of cervical extension. So if I'm trying to stretch the right scalenes, I'm going to left side bend, a little bit of right rotation, and then a little bit of cervical extension. And again, I'm going to hold that for about 30 to 60 seconds. And as you see right here, I can even palpate those muscles. Again, string-like muscles that are going down to the collarbone. Even though they insert on the first rib, you'll be able to feel them just above the clavicle. So there's your right scalene stretch. Left side bending, right rotation, cervical extension.